This study is regarding regional differences in the blood-brain barrier permeability, measured with dynamic contrast-enhanced MRI imaging. The purpose of this study is to investigate the BBB permeability of cognitively normal elderly people and to set a normal standard based on the result. Also, we aim to analyze regional differences and factors that affect BBB permeability. We recruited 35 cognitively normal elderly adults and underwent DCET1 weighted imaging. And the following variables such as vascular risk factors, global cognitive assessment scores, APOE genotype were investigated. Visual assessment of brain imaging was also done for the participants. We used the following MRI imaging protocol and used an acquisition time of 10 minutes in our study. In other studies, it was recommended to use an acquisition duration of 15 minutes or longer. But considering the lower contrast to noise ratio with longer acquisition duration and compliance of participants, we believe a relatively shorter acquisition duration is more suitable in our study. We used Nordic ICE software in our analysis. For calculation of BBB permeability, we used K-trans, which is a leakage rate. And to generate K-trans, we used the Patlik model. From the generated K-trans map, we drew ROI manually and also automatically. In this method, we calculated BBB permeabilities for each region of the brain. These images are exemplary images of the normative distribution of the hippocampal K-trans value. In statistical analysis, we used SPSS to analyze the following variables. As a result, we obtained the following data. And we did not find any statistically significant correlations between the BBB permeability and these variables including age. When we compared K-trans values of each brain region from automated segmentation, there were no significant differences between the right and left sides. Among white matter regions, the occipital lobe showed higher values than other brain lobes. Among gray matter regions, the thalamus showed the highest K-trans value, and putamen showed the lowest value. The higher values of the thalamus region are similar to a result of a previous animal study. We suspect that this is due to the proximity to BBB-free areas such as the choroid plexus. The K-trans values of the manually drawn hippocampus were higher than those of other regions, while K-trans values of the automatically segmented hippocampus did not show such differences. Contamination with the choroid plexus or inclusion of arteries during manual ROI selection may have contributed to these high K-trans values. This table shows BBB permeability values from the previous studies in comparison to this study. Overall, the K-trans values of various brain regions in our study were similar to or slightly below the values previously reported by Kramer and Larson, Montagna et al., and Yu et al. But others showed a great difference in permeability values. We think that there are several reasons for such discrepancies. Different models including the Patlik model and the Tofts model have been used to obtain BBB permeability values. And also different imaging acquisition protocols and K-trans units were used in the previous studies. We believe the narrow range of the age in this study results in such insignificant differences in the BBB permeability. And we plan to include younger participants in future studies to clarify the relationship between K-trans values and age. Our results showed that BBB permeability is different in each brain region of cognitively normal older adults, which means BBB integrity varies across the normal adult brain. And we recommend considering this regional difference when evaluating BBB permeability in patients with neurodegenerative diseases.